In this video, we are going to learn how to memorize drugs easily using prefix, suffix, and root of the drug names. Instead of memorizing individual drug names, you should learn them as a group using common prefixes, suffixes, and roots of the drug names. Now we are going to learn them in the alphabetical order. However, there are some exceptions to this, as some drugs may not have the same prefix or suffix but fit into the same group. Let's get started now. So here we have in the first column the prefix, root, and suffix. In the second column we have examples of the generic names, and the third the medicine category. First suffix is ethyl. Examples are evenethyl, vardenafil, tadalafil, sildenafil. They are a category of drugs called phosphodiesterase inhibitors. They inhibit the enzyme phosphodiesterase, which is usually used in case of pulmonary hypertension. The next suffix is azone, betamethasone, dexamethasone, mometasone, fluticasone. They are corticosteroids, which means they reduce inflammation and is commonly used in asthma. The next one is bicin, doxorubicin, epirubicin, valorubicin, idarubicin. They are anti-neoplastic and cytotoxic agents, which means they are used in cancer. The next one is bitol. Examples are phenobarbital, butabarbital, secobarbital, butalbital. They are barbiturates, which are seen as depressants, antiepileptics, hypnotic agents. Their main action is CNS depression, and they are also used in anxiety. Anxiolytic agents they are. The next one is caine, lidocaine, bupivacaine, mepivacaine, prilocaine. They are used as local anesthetic, which cause absence of pain and may be used in surgery. CEF, CEPH, cefaclor, cefdinir, cefixime, cefprozil, cephalexin. They are cephalosporin antibiotics, which are bactericidal, and they are a large group of antibiotic. Xylin, which includes amoxicillin, ampicillin, oxacillin, dicloxacillin, nafcillin. They are a group of penicillin antibiotic category drugs, and they are used against bacterial infections. Cort, clocortilone, fludrocortisone, hydrocortisone. They are corticosteroid. Again, corticosteroid comes which reduce inflammation. Then the cyclin, doxycycline, demiclocycline, minocycline, tetracycline. They are tetracycline antibiotics which are used to treat infections. Next, dazole, which include albendazole, mebendazole, metronidazole, tinidazole. They are a category of anthelminthic, antibiotic, antibacterial. So anthelminthic are drugs which are antiparasitic drugs. They expel the parasitic worms from the body. Next one is dipine, amlodipine, phalodipine, nifedipine, nimodipine. They are calcium channel blockers which lower the BP. They are antihypertensives. The next is dronate, alendronate, etidronate, ibendronate, risedronate. They are bisphosphonate bond resorption inhibitor. So bisphosphonates generally prevent or slow down bond thinning, which is seen in osteoporosis. Next is iprazole, esomeprazole, omeprazole, rabiprazole. They are proton pump inhibitors which reduce acid amount of stomach. Then Finac, Bromfenac, Diclofenac, Nipafenac. They are non-steroidal anti-inflammatory drugs which reduce pain, decrease fever and inflammation. Next, we have floxacin, ciprofloxacin, levofloxacin, moxifloxacin, ofloxacin. They are quinolone antibiotic, which of course inhibit the growth of bacteria. Next is gliptin, saxagliptin, sitagliptin, linagliptin. They are anti-diabetic drugs, inhibitor of DPP4 enzyme. These group of drugs block DPP4 enzyme and its action. Glitazone, pioglitazone, rosiglitazone, troglitazone, they are anti-diabetic thiazolidinedione class, which are used to treat type 2 diabetes. Next, eramine, brompheniramine, chlorpheniramine, pheniramine. They are antihistamines which are used to stop allergy symptoms. Lamide, acetazolamide, brinzolamide, dorzolamide, methazolamide. They are carbonic anhydrase inhibitor, which are mainly used in the treatment of glaucoma. Next one is MAB, adalimumab, daclizumab, infliximab, omalizumab. They are monoclonal antibodies made by identical immune cells which are all clones belonging to a unique parent cells. These are used to fight cancer cells. Next group is mestin, carmestin, extramestin, lomestin, bendamestin. They are alkyliding agents or antineoplastic which are used in the treatment of cancer. Mycin, azithromycin, clarithromycin, clindamycin, erythromycin. They are antibiotic, antibacterial group of drugs. Niacin, darifenacin, solifenacin. They are muscarinic antagonist or anticholinergic agent. They are a group of anticholinergic that block muscarinic receptor. Next one is nazole, fluconazole, ketoconazole, miconazole, tericonazole. They are antifungal which are used to treat and prevent mycosis such as athlete's foot, ringworm, etc. Olol, atenolol, pindolol, metoprolol, timolol. They are beta blockers which are used to decrease BP. Olon, nandrolone, oxandrolone, oxymetholone. They are anabolic steroids which are synthetic versions of testosterone and they have action similar to testosterone. Onide, budesonide, cyclosonide, desonide, fluosinonide. They are corticosteroids again to reduce inflammation. Omeprazole, dexlansoprazole, lansoprazole, pantoprazole. They are all proton pump inhibitors. Before we learned the eprazole, now this is omeprazole. All are proton pump inhibitors. Next is parin, dalteparin, enoxaparin, heparin, tinzaparin. They are antithrombotic, anticoagulant. So antithrombotic is to reduce formation of blood clots and anticoagulants are blood thinners. Phylline, aminophylline, diphylline, oxtriphylline, theophylline. They are xanthine derivatives which are bronchodilators, mainly used in asthma. Pramin, clomipramin, decipramin, imipramine, trimipramine. They are tricyclic antidepressants or TCA. They are used in case of depression. Pred, loteprednol, prednicarbate, prednisolone, prednison. They are corticosteroids again. Pril, benazepril, captopril, enalapril, lisinopril. They are ACE inhibitors which are used in hypertension and all. I've made a video about ACE inhibitors. Next is profen, phenoprofen, fluorbiprofen, ibuprofen, ketoprofen, NSAIDs. They are NSAIDs. Ridone, iloperidone, paliperidone, risperidone. They are atypical antipsychotics which are used to treat psychotic disorders. Next one is sartan, candesartan, losartan, olmesartan, valsartan. They are ARBs or angiotensin II receptor antagonist. So I've made a detailed video about ARBs also. You can check them out. Cimide, furosemide, torsemide. They are loop diuretics or water pill. Cetrons, alocetrone, dolacetrone, granicetrone, ondansetron. They are serotonin 5-HT3 antagonists which are used to prevent nausea and vomiting. So the next one is statin. Atorvastatin, lovastatin, pitavastatin, simvastatin. They are HMG-CoA reductase inhibitor or the statins which reduce the cholesterol by inhibiting HMG-CoA reductase enzyme. Sulfa, sulfacetamide, sulfadiazine, sulfamethoxazole, sulfasalazine. They are antibiotic, anti-infective, anti-inflammatory agents. Tadine, which include cyproheptadine, desloratadine, loratadine, olopatadine. They are antihistamines which reduce the allergy symptoms. Then again we have tadine, amantadine, rimantadine, which are antiviral, anti-influenza A. Then terol, albuterol, formoterol, levalbuterol, salmeterol. They are beta agonists which are used as bronchodilators. Thiazide, chlorothiazide, hydrochlorothiazide, methiclothiazide. They are thiazide diuretic or the water pill. Tinib, crizotinib, dasatinib, gefitinib, imatinib. They are antineoplastic or kinase inhibitors against the cancer. Trel, disogestrel, etonogestrel, levonorgestrel, norgestrel. They are female hormone progestin. Tretinoin, acitretin, alitretinoin, isotretinoin, tretinoin. They are retinoids, dermatologic agent form of vitamin A. Triptan, almotriptan, elytriptan, rizatriptan, sumatriptan. They are anti-migraine selective 5-HT receptor agonists which are used to reduce the effect or intensity of migraine headache. Next one is ptyalin, amitriptyline, nortriptyline, protriptyline. They are TCAs. Vir, abacavir, efavirenz, nevirapine, ritonavir. They are antiviral, also anti-HIV drugs. Of course, VIR means antiviral. All of them are antiviral drugs. Next group of vir is adifovir, entecavir, ribavirin. They're antiviral, anti-hepatitis, used in case of hepatitis. Next vir, acyclovir, famciclovir, penciclovir, valacyclovir. They are antiviral used in herpes, anti-herpes. Again, we have vir here, cidofovir, ganciclovir, valganciclovir. They are antiviral, anti-CMV. So anti-CMV, CMV is for cytomegalovirus, used in cytomegalovirus. Next vir is oseltamivir, zanamivir, antiviral, anti-flu, used for flu. Woodin, lamivudine, stavudine, telbivudine, zidovudine, antiviral nucleoside analogues. Zipam, clonazepam, diazepam, lorazepam, temazepam, they are all benzodiazepines. Zodone, nifazodone, trazodone, vilazodone, they are antidepressants. Next is Zolum, which includes alprazolam, estrazolam, midazolam, triazolam, they are again benzodiazepines. Next is Zosyn, alphazocin, doxazocin, prazosin, terazosin. They are alpha blockers which are used to treat high BP.